So before opening it to Q&A from the audience, I actually have a question that I'd like all of you to respond to. So what have been opportunities either for success or challenges that you've had in dealing with your colleagues in local government, in zoning, in housing, in transportation, in other areas to get them to understand these issues?
That's all right. I think there's a number of challenges, but what I would say, and I didn't list the agencies that are in the planning and development section in Fairfax County, and you can see those in the bio, but I think, and this is not just a health-related issue per se, but I think it's getting people to understand how what they do on a day-to-day basis connects to the core issues. I think especially in large organizations and complex communities, people tend to get very specialized in terms of what they do. And in some instances, a lot of what they do is very technical. I mean, if you're the zoning administrator in Fairfax County, I make a point of never reading the zoning ordinance. I never give opinions on the zoning ordinance. The thing is this thick. It hasn't literally been comprehensively amended in 40 years. And when we do it, and that's on the list, it's going to be a nightmare. So it's very easy to get segmented and look at issues in a very narrow way. So my job as a leader in Fairfax County and in the community is to get people to look at the issues holistically. When they make that connection, the amount of brain power that we have in our organization, our community is amazing, and the problems we can solve are fantastic, but getting them to look at the problem in a bigger way is really fundamental. And our economic success strategic plan did that. Take a minute when you can to look at our 6 goal areas, look at our 4 focus areas, and our vision that we've established for each of those focus areas is really important. That's what we aspire to be. So as leaders, we're leading to that aspiration and thinking holistically while we do it.
As I said in the beginning, nurses are pretty practical people, and we try to find practical solutions, and usually we're pretty resourceful. I've only been in my position for a year, but my main goal was to build collaborative efforts with the healthcare agencies in my community. I see some very friendly faces out there, people that I collaborate with. When I first started, I felt like the only word I can think of is stovepiping, where we're just all in our own little world and we're all doing our own little thing, each trying to do good work. But what I found we had to overcome was reaching out to one another and working together and multiplying our work. For example, the dental bus and the wonderful folks at Neighborhood Health. We have been really trying to reach children in the community, and I think we're making an impact. There was a child that I was just told about this morning, a 4th grader who had never been to the dentist, went on the WOW bus, got treated. The child had health insurance, dental insurance that whole time, and had never been reached. So now we're going to get together to try to talk about how do we overcome that barrier. And it's just really trying to work together as groups, even though we're representing different agencies, to try to work together collaboratively, efficiently, economically, to solve problems without duplicating services.
I think that the more that we're able to target what the specific goal of our joint efforts are, the more successful we are. Let's take homelessness. Okay. 10 years ago, well actually 8 years ago, Arlington County developed a written plan for ending homelessness. It was mandated by HUD, you know, one of those unfunded mandates from HUD that you all are facing. But we actually took it seriously and developed a cross-cutting collaboration that involved the Department of Human Services, the Housing Department, the business provider, business sector, the nonprofit sector, some of them are here, and basically worked nonstop by identifying who these individuals are, what their barriers to housing were, and then systematically housing them. We basically decreased the homelessness rate in Arlington by about 60% in the last 8 years, and we have ended veteran homelessness. We're right now working on chronic homelessness. I have to tell you that one of the individuals who laid the foundation for all this work is right here in this audience, Marcia Allgaier. And going back to housing, over the last 3 years, the county developed an affordable housing master plan. We looked at where all of how the market affordable units have declined, how we have to increase our committed affordable units. And the beauty is that there's a marriage in Arlington between the housing department and the Department of Human Services. So as we construct more new buildings, we deliberately work with the developers to set aside committed affordable units for 30, 60, 90 years, and then my department steps in and then provides housing grants, additional rental subsidies to make these units that are supposed to be affordable but are only affordable at 60% of area median income, to bring them down even further to 30%. And we work very closely, and the county government is really committed to this. So I think it really takes an effort to focus on what the issue is, bringing all the right players to the table, and then just hammering at it until you can get some traction.
Are there questions from the audience? Could you wait for the mic, please? Which is somewhere. It's coming. And don't forget your name.
I'm Dr. Martha Wellman. I'm a pediatrician, and I'm the medical director at Neighborhood Health. And I wanted to thank all of you for this presentation. It's very interesting. And my question is about early childhood and access to preschool. You know, if we look at the maps of the poverty, we know that it falls disproportionately on the young. Having 16 years of experience in Alexandria, I've seen kids go through the whole system. And even though perhaps the data doesn't show it, as a pediatrician, my experience is that the kids who are in the preschool setting are much more successful. The families are much more connected. And the other thing I've seen is because of the shortage of opportunities for 3-year-olds and 4-year-olds to be in preschool, the children who get it are the ones whose families have their act together. And the children whose families don't know to apply in February for a preschool spot next September are the ones that really need to be there, and they are falling through the cracks. We're seeing them as doctors. And I'm wondering about, number one, is there any movement in your plan in Fairfax County to expand opportunities for early childhood, quality early childhood experiences for children? And in Alexandria, how to improve the linkages for these high-risk families that don't know how to fill out applications and don't know how to plan, 8 months in advance for these kinds of things.
Let me try to address your question from a couple different points. Fairfax County public school decisions are made by the school board and the school administration. Like us, they also have a strategic plan. Next week, actually, the two boards, the Board of Supervisors and the County School Board, are going to have a joint retreat at Mount Vernon. And the premise of the discussion will be our strategic plan and the school board's strategic plan and the crosswalk work that's already begun. Some of that work involves things like early childhood development. We've been able, through some of our planning efforts And actually, if I had more time, I'd love to talk about some of the public-private partnership joint venture activities that are underway in Fairfax. But one of the 24 P3 joint venture initiatives that we have is located in Seven Corners. And very specifically, what we're talking about there with the schools is to develop, using county property, the old Wilston Elementary School site, redeveloping that. Now, this is in the future. It's not going to be next week because there's a lot of different things that have to happen. But understanding the correlation between the issues you raised, early childhood development with a Fairfax County Public Schools Center, co-located with County Human Services facilities located on site, and the residential component that is a part of the Seven Corners master planning work that our board adopted last summer. So conceptually, there's a lot out there. Specifically, that's one example that's down on the ground. And if we were having this meeting in about a month, I'd probably be able to report out more detail from the discussion from our two boards next week. But I think getting the two boards to think together about those types of issues, and I know personally the school superintendent, Dr. Garza, is very committed to that. So I expect some more detailed direction coming out of that discussion next week.
ACPS just passed their budget. I believe the city approved for also a new preschool center that would be in one building. Right now, they're scattered out throughout several of our elementary schools, and we're overcrowded. The other thing that we just did the last week in April is I went with a group of folks from our FACE Center. Now I got to tell you what FACE Center means: Family and Community something. But what it means, yeah, they know over there. What it means is that we have a group of employees that actually reach out to communities that have issues like this. For example, a few weeks ago, they had a computer class for parents. We do health education in the schools with this group. The FACE Center planned to do a screening and assessment day, physical assessment day for children that were 3 and 4 years old to try to get them ready for preschool. Members from Neighborhood Health came to get them signed up for health care insurance with Medicaid if possible. And also just helping them with that registration process, which can be pretty intimidating now that everybody's switching to an online process. So that was our first attempt. So as in many first attempts, you find out where you failed. And so all 8 children that I saw, some of them with significant health issues, didn't have any immunizations or TB testing to get into the school. So we talked about next time partnering with the health department. So again, it's that idea of thinking outside the box. We went to them. We went to their community. We had it in the basement of one of the apartment buildings. I've got my to-go bag now that I can go do a health assessment anywhere. And but just going to the community and providing the services they need to try to capture those kids who really, like you said, really are going to benefit from preschool education. But it's thinking outside of the box and going to them, partnering with different community members in order to make it happen. So we'll continue to do that in the future. Did that answer your question? Okay.
Well, I was just going to say, I think we need to urge also the folks in Richmond to make sure we have an adequate supply of child care subsidy monies, because it is very costly, and we have a wait list of those who are waiting for child care subsidies. And to ensure that the changes in the legislation regarding child care licensing and what goes into the preschools and the very early education centers comes up to speed. Virginia is way behind in that area. Virginia, the legislature has made some changes, but it's taking a while for the Virginia Department of Social Services to actually put these things into action. So anything our good colleagues in Richmond can do to push that along, it's appreciated.
That was for Senator Barker. That was Other questions? Grace.
Good morning. My name is Grace Katabaruki with Venture Philanthropy Partners. I've really enjoyed the panel. Thank you so much for all of the work that you are doing. It's really innovative, and it's great to hear that it's happening in our communities. I have a question specifically for our colleague from Fairfax County. I think it says volumes that you are in planning and you are here as a part of this conversation. I think that's a change we need to see in many jurisdictions. And just wondered if you could talk just a little bit more when you said that you guys are thinking ahead about issues and challenges, and you also emphasized that your strategic plan is about people, places, employment, and government, and not just employment. I wonder if you can talk a little bit more about the challenges you see ahead vis-a-vis people, because I imagine that is part of why it was important to you to be here today as part of this conversation. Thank you.
Yeah, it's a great question, and I probably don't have a great short answer, but I'll try to do my best. And we came to identify our 4 focus areas through a series of iterative conversations, but one of the things that we said right up front was that, and to some degree it's obvious, but when you have economic development discussions, sometimes the people part of the equation is not what people think of first. And for us, attracting and retaining people, not just people in jobs, although that's really important, but people in our communities, people in our neighborhoods, that's got to be our first focus. And you've got to have places where people want to be, not just where they work, but where they want to live and where they want to just hang out and where they want to go to school and where they want to just do things that make a community a community. One of the things that we talk about when we look at our, for example, our public-private partnerships and joint ventures that I mentioned a minute ago, we have a number of different metrics that we use. Some of them are sort of the traditional ho-hum. They're important. Are we creating value? And there's a lot of different ways to talk about what constitutes value. Typically, in most local governments where we're so property tax dependent, 68% of our general fund is derived from real estate property tax, and that is a very high percentage, and it's very, very difficult to be able to sustain that going forward. So value in terms of property tax that we create is very important. But the other piece that's really a little bit more nebulous, but it's really important, is a term we call, are we building community? And you can literally go to different parts of Fairfax County, and right now we're doing a joint venture in Southeast Quadrant. And some of you, if you follow the blogs or the local papers, I think the Post has covered a little bit of it. It's a 7-acre redevelopment project where we're removing blighted properties. We're working with a developer to put in a market rate and affordable housing, but we're creating something that doesn't exist. It's not quite that linear. There's a lot more to it than that, but we are trying to make a statement and build community that conforms with both the comprehensive plan and the master plan, both of which were developed through extensive community involvement over a period of a decade to try to make something that doesn't exist today. If you go to Reston, where we're doing Reston Town Center North, and we're building 700,000 square feet of vertical mixed-use residential with ground floor library and homeless shelter, that's a different type of community environment. And Reston is a very different place than Bailey's or Seven Corners. So Dr. Wolf mentioned Richmond Highway. We have Old Mount Vernon High School. Stay tuned for that. That's a great opportunity where we have 140,000 square feet of existing historic school structure on 11 acres of county-owned property adjoining 40 acres of Park Authority property that's our partner. And we're looking at a joint venture opportunity there to build and create something. So the people part of the equation, you know what? If people don't want to be in Fairfax, Arlington, Alexandria, why do we exist? I mean, that's, and I'm getting into a little bit of lecture mode here, and I apologize, but I think one of the challenges that we have in local government, and I probably could have said this with the initial question, we tend to end up being more internally focused in terms of our process and our paperwork and our rules versus being externally focused into the community. As a planner, that's kind of how I think, but at the end of the day, if we're not building community, then why are we here? And so that's got to be the foundation. And it sounds simplistic. It may sound a little idealistic, but if you can't make that correlation between everything that we're doing and talking about today and actually with that as an outcome, then I think, we have to question what we're doing. Sorry, I rambled a little bit, but hopefully you got a couple nuggets out of that.
Other questions? Nope. Yes, ma'am.
Hi, good morning.
Hold it.
Thank you. I'm Patricia Garcia, and I work for the Fairfax County Public Health Department. And Robert, I'm somewhat familiar with the economic plan because I am a graduate of the Middle Management Roundtable, and where you came to speak and share the plan. I have a question. First, I'm going to date myself by saying that I was around for the signing of the PROWP that President Clinton signed, the Personal Work Responsibility Act, where we started moving people from welfare to work. And I was in San Francisco County at the time, and it was during a time when the economy was doing very well, and we understood that if this thing worked, it was working because the economy was working. And what we feared is if economic downturn, and then how well would we be, how successful would we be at moving people from welfare to work. What we found our success in is that once we engaged the business community and asked the business community to begin to mentor those clients that were moving from welfare to work, those clients that actually found a mentor that was willing to stick with them through their ups and downs and learning cycle. And as we all know, breaking the cycle of poverty is very difficult. As those business managers that stuck with those clients were some of the most successful. What I'm wondering is, even as I read your plan, I'm not really sure where business is at the table, and I know personally as someone who had to break the cycle of poverty, that it was strong but kind women like those sitting at the panel that taught me how to be a professional, and I think that mentoring is very important, particularly for those that are leaving college with a degree and don't have those mentors or might not have been raised by mentors in their community. I'd like to see them at the table. Question, how are we doing that?
I was going to answer even if it wasn't a question. Actually, and that's a great point as well, and I didn't really get into the who we've involved in the development of our plan. And I guess first and foremost, we started off, and this is not uncommon, we went to sort of the established norm. The Board of Supervisors has appointed an Economic Advisory Commission that's made up of about 50 business, civic, community, and other representatives in the community. We have an implementation committee that's a smaller, about 25-person subset of the full Economic Advisory Commission. One of the things that we figured out in the very beginning is that the EAC was created about 15 years ago. And the economy and sort of the perspective on the economy at that time was a little bit different. And while it's not a final act yet, Supervisor John Faust, who chairs our EAC and represents the Drainsville District in Fairfax County, is working with Chairman Sharon Bulova to allow us to reconstitute the EAC. And I'm really glad that you mentioned mentoring, because I think that really reflects the recognition by the county board, the staff, and the community that some of the traditional interests that end up determining what economic success should be and what the strategies could be going forward, we need to have different points of view. We need to look at it differently. And so that process is underway, and maybe there's a way to, and I've got two of my colleagues in the back who are on my core team, Etta Davis and Dale Castflow. We are constantly trying to cast a wider net for people who want to be involved. So with our plan, and I'm shifting gears here from sort of the structured to the unstructured, when we did our initial work with the plan, we engaged about 250 participants. Basically, anybody who wanted to talk to us, we would talk with them. You know, we would convene the chambers of commerce. We would talk to the small businesses. We would talk to the corporate interests. We would meet with citizen groups, homeowners associations. You would think if you threw the doors open, everybody would come pouring in. It doesn't work that way, as we all know. We're doing it electronically. We actually have a survey that's online. Can they Google economic success survey or do I need to get that and we can send it out electronically? All right, we'll get it out electronically, but that's a way for you all who have an interest in having your voices heard. And I don't care if you're in Richmond or Southwest Virginia. I moved to Northern Virginia from Roanoke County. The good ideas, we don't have a monopoly on good ideas in Northern Virginia, so we'll take good ideas from anywhere in the state. But economic success today, I believe, is defined and will be defined differently than it has been historically. Just real quick on the mentoring. I like to describe myself as a serial mentor. I'm also a serial mentee. And I think that concept is really important. In Fairfax County, we do it extensively. In terms of what you described, we don't have that as a specific action in our plan. I love it. I love the idea, love to call it out. I think it's something that we have a lot of people who would be very interested in doing that, and I agree with you totally. There's a huge need, whether it's a small business, minority-owned business, or any other type of business. I think that is important. So hopefully, again, I touched maybe some of your points.
I just wanted to add again in that whole theme of thinking outside the box. One thing we're doing at T.C. Williams High School is we're instituting a program called the Oral Health Impact Project. As you can tell, I'm into teeth. But the beauty of this program is they work with students within the high school to teach them about being a dental assistant. So there's the potential for some of our students to graduate and be immediately employable as a dental assistant. So not only does the school district provide dental care within the high school for those students who need it, but we have the added benefit of doing just what you're saying. We're mentoring students into a profession. And I think that outside the box thinking of how we can dual track and do programs that affect more than one thing at one time is really beneficial. So I'm excited to see how that changes, because right now the dentists at the Oral Health Impact Project told me that minorities are vastly, not excluded, that's not the right word, but they don't seem to be called to the dental profession. And they hope by these oral impact projects that they're doing that more and more kids will look at dentistry as a viable profession for them, whether from a dental assistant, dental hygienist, or dentist.
Any other questions? Yes.
Good morning. I'm Nancy White from Arlington Free Clinic, and I want to thank the foundation for bringing all of us together today. One of the things that I've been really excited to see in Arlington are some of the conversations that are going on among the various safety nets, so that it's no longer the housing people over here and the food here and the domestic violence and the health care, and that we're starting to have some really great conversations about how we can work together to start to make sure that we're thinking about one another. What are the questions we need to ask of our clients, because we see barriers to health all of the time that we can address as a health clinic. And so I'm just interested in comments about how to further formalize that, or any ideas that you have about how we can do that in a better way?
Thank you, Nancy. I think that we have a luxury in Arlington of being small. We have a really interesting initiative that Nancy's mentioning going on with Marymount University, now housing a nonprofit center where we've gotten a lot of the safety net providers in sync. Those same safety net providers, also a lot of them belong to our coalition that was working on ending homelessness. So we have AFAC for food assistance, and we have ASPAN for homeless services, and we have folks who are working in the field of health or the field of reentry for juveniles. We have a lot of different players. I think the task here really is to add a few more components also and try and bring out some of those sectors that haven't been represented. Particularly, I want to emphasize those in the field of working on mental health and substance abuse treatment. I think, though, that particularly in Arlington, we don't have a strong coalition of providers, and our form of working is much more hierarchical than in the safety net sector. But really, you know, forming these horizontal alliances is much more successful than basically operating as government to vendor, you know. I mean, there is, of course, the responsibility of government is to be a good steward of the public dollars, but the more we can sort of equalize and be transparent about what we can and can't do, because there's a lot we can't do, and bring in the folks from the nonprofit sector and the business sector to be able to offer up what they can, we will definitely be more successful. I'm looking forward. I know Ruben is not maybe looking so much forward to the map process, to our community health mapping process that's coming on, because I think that is the prime opportunity to bring all those stakeholders forward, you know.
Again, that's probably a point that we could talk a lot about, but I'll take just one of our metrics that we've identified, and that is making access to educational opportunities, a healthy lifestyle, jobs, and equity, our community brand. And, you know, the cynic might say, well, from an economic success standpoint, you know, you're correlating brand with economic success. There were some raised eyebrows the first time we started talking about equity as a part of our economic success plan. We had some people in the county with the various groups that we were working with that questioned that. And I raised the point because I think part of our job is to, in addition to convening people, but also to try to get them to have some of these conversations maybe that they're not used to having. Some of you have heard of the concept of neighborhood college. My friend Verdi and I worked together for a long time, and I worked very closely with his successor, Pat Harrison, on a number of different initiatives between our human services operation and our planning development folks. But one of the things we used to say about neighborhood college, and I was town manager in Herndon from '88 to 2000. We actually had the first neighborhood college in Northern Virginia in Herndon in 1998. And one of the things that we said, we talked about a lot of issues in neighborhood colleges that were very difficult. But we were able to get people who wouldn't normally be in the same place at the same time to talk about issues that they wouldn't typically choose to talk about. And so one of the things that we have done and we are doing with the full support of our board with our economic success plan by focusing on social equity and the implications not only to the economy, but just to the fact that it's the right thing to do. We're having those conversations, and again, alluding to what I said earlier about we have a lot of smart people. We have a lot of horsepower in our community and our organization, and when you let that intellectual capacity free to tackle some of these issues, it's amazing what you can do. Plus, it's a lot of fun for people like me.
I think the big thing is, like for today, I don't know that you've ever had a nurse speak in your foundation before. And so having boots on the ground people in your meetings to hear what actually happens, because you know, I heard a lot about access to health care insurance, but from my perspective, you can have insurance, it doesn't mean you have health care. And so finding providers that can do it, so having more stakeholders involved with boots on the ground people that can really tell you the policies that were created, how are they actually impacting the people they were created for? Because sometimes the policies we have, for example, I have to do hearing and vision on every kid that comes through the school, but the state doesn't require me to check their teeth. And there's way more kids in our public school with bad teeth than they are that can't hear. That's a policy that should be changed, I think. We have children in Virginia, they only have to have a physical to get into school from grades kindergarten, pre-K through 5th grade. I have immigrants that come from other countries with no medical background at all. They've never seen a doctor, but they get right into our schools without a physical. You know, really, is that really what we want to do, or do we want to be more proactive and say, you know, you have to have at least a physical even if you're in 9th grade, so we can catch some of these chronic conditions of childhood that get overlooked because the child was never examined.
Yes, my name's Cressida McCain with the Stroke Comeback Center, which is based in Virginia. One group in terms of boots on the ground that has been an area that seems to have been overlooked in your discussion is the question of accessibility for people with illnesses like post-stroke and their recovery after they're released from the hospital. Because there's a real gap in services that we're finding in Northern Virginia and the Washington area. And I guess I would like to hear your views on how partnerships with groups like the Stroke Comeback Center might work more collaboratively to ensure greater access to stroke survivors. 30% of our clients are on scholarship, full to partial. And we just find that our need is fairly substantial in terms of getting access to a community that pulls them back into their community, both with fitness, cognitive services, and speech services.
One of the nice things about coming to an event like this for me is that I learn a lot more from you than you learn from me. And so part of the mission that we have in working with our human services folks in Fairfax is the planning and development side of the equation. We develop facilities that allow them to provide the types of services that need to be provided. So I don't have a specific answer for a program for the particular needs that you identified, but one of the things that I would ask this group to help us do, and I mentioned a couple of the partnership opportunities that we have around the county in Reston and Bailey's and Seven Corners on Richmond Highway. We are looking for those types of partnership opportunities with nonprofits and public health, community services organizations that we can work with to meet those types of needs in our community. And so whether it's the group that you represent or other groups that are represented here today, I'd really like to, I don't know the best way to do that, I'm kind of asking a question now of you, to be able to get that information, and maybe Pat, that's something you and I can work on, but that'd be really helpful. So I thank you for sharing that.
I concur with what Robert said. But the truth of the matter is that's an area that's probably pretty much overlooked by our department. I'll just come out and say that. I mean, we do have the department. Lucky thing is we do have a lot of different Virginia departments co-located in our Human Services Center. So, for example, the Department of Rehabilitative Services actually has a full-time presence at the Arlington County Department of Human Services. And we have programs for those who are permanently disabled. We work also with Independence Center, which is a nonprofit in Arlington that helps those with disabilities to live more independently. But like Robert said, there's never enough services to support those who are in need, and we would welcome a partnership with you too.
Other questions? We have time for one more. Sharon. Oh, sorry.
For the Prince William Health District, I'd like to, since Robert likes to mentor, I challenge you to mentor all planning and development agencies in Northern Virginia to be as proactive and part of the healthcare arena as you've been.
If you'll help me.
Thank you so much. Let's give our panel a warm applause.